Welcome to Naath Update. Today I'm going to give you tips about how you dress wounds or you watch dirty wounds. Uh, okay, this is it. When a patient comes to you, first of all, you need to put on gloves. Okay, you take your gloves, right? You take your gloves. Sorry, see, you take your gloves. You put them on your hands. You double them. If the wound is dirty, so dirty, and there's a lot of germs in that wound, it is very unclean or is smelly, you need to have, you need to double the gloves on. Step two, you need to have a mask. You need to have a face mask so that the smells on the germs don't go to your mouth or to your mouth, because when you smell, see, something is smell or something is dirty. Also, germs, germs, they're invisible. You cannot see them, so you need to be protected. So you need to put the mask in your mouth to protect you from getting infection from certain uh, decay wounds. That is a step one. Step two, I mean. Now coming to step three. Step three, you need to wash the wound with water and soap. Make sure you clean the wound with water and soap. Very clean. You clean it. You remove all the dirt. Remove all remove all the dirt. You make sure the wound remains so clean. And if it remains so clean, before you use any spirit or use iodine or any hydrogen, you make sure you wipe it well and dry it. When the wound is so dry, now you put the eyes, you dried it off with hydrogen, and you put the hydrogen, and then after the hydrogen, you take the cotton, okay, you take this cotton piece of it and put in it, put some spirit in it, and then also clean it, clean it, clean the wound gently with it until you make sure it dry. There's no water coming out from that. Then you put the iodine to dry and make sure it's not too smelly. All right. Then now you cover it. Okay. And when you cover, you don't use cotton to cover the wound. Okay. You use bandage. You take a piece of the bandage, you roll it. Okay. You roll it well. Then you place it on the wound, and now you wrap it. So you put it on the wound, now you wrap it with a bandage. You wrap it up with a bandage. Okay? When you wrap it up with a bandage, you make sure it's not tight. You don't tie the bandage. You make sure also you loosen it for the air to go in so that it doesn't it doesn't stick into the wound, because the wound also need air. And then you caution the patient that they should not be moving around during uh, when the wound is so much, it's too big. You just tell your patient to be patient, and then now you give them antibiotic to take to reduce the pain, And after you're done with that, you remove the gloves gently. So make sure you remove the glove gently. You first remove the first one, and then you remove the second one. And be careful when you're removing it. Then after you remove the gloves, don't rush into removing your face mask immediately. First, go and wash your arm with running water and soap or harsh to make sure all your hands are clean, and to make sure there's no germs remain there. You make sure you wash it with a flow of water or ash with soap, and then from there you can remove your mask. After you remove your mask, you make sure you wash your face. Okay, you wash your face well before you touch anything, food or anything. Okay, to make sure everything is clean. So you do that daily for you to get protected, so you don't get protected. Doctors also get contamination from the patients. So you make sure you don't have to touch blood with your bare hands. Use protected gloves and mask. Thank you.